So that brings me to what can you ask as a patient to minimize your risk of radiation? So, if your doctor recommends a CT scan, it's completely okay to ask questions like, is this the best test for me? Or could an MRI or an ultrasound give the same answer? Is this a low dose CT scanner? Do I really need multiple phases or will one scan be enough? Now, it's also helpful to understand the trade-offs here. MRI and ultrasound don't use ionizing radiation at all, so they're safer in that sense. But MRIs are much more expensive and not always available quickly, especially in emergencies. Ultrasound is great for soft tissues and blood flow, but isn't always sensitive enough to detect deeper or more complex problems. So sometimes a CT really is the right choice, and the key is making that decision thoughtfully. So, to summarize, CT scans save lives every single day. They are an incredible diagnostic tool and one I continue to rely on in my practice, and I have had them myself and I will have them in the future if needed. But like any medical procedure, they work best when used wisely and safely. And that claim that CT scans might cause 5% of all cancers, it's not necessarily true. It's based on computer modeling, not real world data, and it likely overestimates the risk. So the whole debate actually reminds me of the issue with antibiotic, and we know that antibiotics can disrupt the gut microbiome, contribute to leaky gut, and often trigger other health issues. And yet, when we truly need them, they save lives. And I think the same logic applies to CT scans. They're not risk-free, but when used appropriately, they can be absolutely life-saving. So the goal isn't to fear imaging, it's to make it smarter, safer, and more intentional. And that's how we protect patients while still using the best technology medicine has to offer.